Hello, 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 everyone. Welcome to Touching You Talk Show. My name is Elder Sheila Black, and I have a very special guest once again this week, none other than Dr. Sylvia Perry. Hi, Miss Sylvia. How
Well,
are you?
hello.
I am so delighted, excited, and happy to have you on the show. So, the first question I always ask is, how long have we known each other?
I would say my whole life, and then some, honestly. But for sure,
Dr. Sylvia is actually my niece cousin. So, yeah, I have been knowing her all of her life. So, I just wanted to talk to her today. She is Dallas's premier pharmacist.
ooh, I'll
And
take
I am
that.
just too excited. Dr. Sylvia is a nationally recognized pharmacist, a two-time best-selling author, a podcaster, speaker, and consultant specializing in pharmacy implementation and administration. So tell me, Dr. Sylvia, what made you decide to become a pharmacist?
Funny story. I went to Xavier University of Louisiana with the goal of being a dentist, and then when I got on campus and lived in the dorm, I decided that that wasn't what I wanted to do, work in people's mouths all the time. But clearly, we have a dentist in the family, so major shout outs and props to her because that was not my calling. And so I thought pharmacy was like a trade because, I wasn't really a sickly child. So to me, it's like, oh, we go into the dry cleaners. We drop off something, pick something up. So that's what I thought a pharmacy was, like dry cleaning, like a trade. And so not until I stepped on Xavier's campus at 18 did I realize, oh, this is a medical profession. I can still help people, not have to work in their mouths and still help them live healthier lives. So I applied to the College of Pharmacy, and the rest is history, I say.
So, how long does it actually take to become a pharmacist?
Great question. So you can do 2 years of prereqs, and then you can apply to pharmacy school if you've met all of those prereqs. I applied at the spring semester of my sophomore year, and then it's 4 years of pharmacy school. So it can take as little as 6 years, or a lot of people get their bachelor's degree first, and then they apply to pharmacy school. So that would be 8 years. And then after you complete pharmacy school, you can do a residency, you can do a fellowship. So that's additional training that's available to you.
So, what's the difference between a residency and a fellowship?
A residency generally specializes in, well, they have general ones, but it's additional training. And then a fellowship is more teaching focused, and it can be specialized as well. So, two different types of trainings, but they're both additional in addition to an optional training as well.
So, is it equivalent to like clinicals? You know how when someone go to school to be a doctor, then they have to go for like clinicals, and then they have to go and they have to work so many hours or whatever before they actually get their degree. So it's equivalent to that very same thing.
Yeah, while you're actually in pharmacy school, they start sometimes in their first year. We'll have students come to our pharmacy to learn the ropes and do those clinical hours. You have to give so many immunizations in order to be certified to give immunizations. So all of that happens while you're in pharmacy school. And depending on your program, you'll either do your clinicals in your third and fourth year, or your fourth year only, or like I said, even starting sometimes in your first year. So yeah.
So when you say you have to give vaccinations, you have to give people shots.
We do. And so that kind of messed me up in the beginning because I was like, wait a minute, I could have been a dentist if I wanted to touch people. But I'm kind of a bit of a dinosaur. So when I finished pharmacy school, we were just starting to give immunizations. So that was new to me. But I actually love it. It's kind of one of my favorite things to do.
So how do you deal with the collapsing vein?
Well,
How do you
I'm not taking any blood. So most of the shots that we give, I'm looking for the muscle. The deltoid
Okay.
muscle is what you're looking for on your
Mhm.
arm, or it can be under the skin. So I'll go in at a 45-degree angle of the back of your arm. Um, so yeah, I don't give any butt shots or anything below the torso. I'm mainly sticking to the arms. So,
Okay.
that is another perk, I guess.
Well, that's wonderful that you don't have to try to search and find veins. That's a good thing.
Yeah.
So, what else can you tell us about pharmacy school for someone out there who may be thinking about it?
I would definitely encourage you to talk to a pharmacist. The thing about that I love about our profession is we're the most accessible healthcare professionals. So talk to a pharmacist. The profession has changed a lot. There's a lot more women pharmacists than there's ever been before. And although we're going through a lot of, we're on the front lines, we're giving the bulk of the vaccinations right now during this pandemic. So there is a lot on us right now. And we're experiencing staffing issues just like every other profession or job or right now. So maybe if they're super busy, that's not the right time to talk to them because there's just a lot on our plates right now. But generally speaking, pharmacy offers you a lot of options. It offers you a lifestyle that you can maintain even working at a part-time level. You can live at a decent level. And you get to interact with the public, and there's many jobs where you don't have to interact with the public. So I really like the flexibility in the profession and the options that it gives you. And like I said, we're going through a pandemic, we're on the front line, so there is a lot of burnout right now. But I think in times like this, it forces the profession to change so that it can remain viable going forward.
Okay, so before we talk about your book and talk about your podcast, let's go ahead and talk about vaccines since you brought it up. So let's talk about some of the vaccines that we definitely need to get. A lot of times people don't want to take, let's say, the flu shot. So let's start with the flu shot. And the person says, well, I'm not taking the flu shot because the last time I took it, it made me sick. So what do you say to the person that says that?
Um, Depending on the person, I might say congrats because your body is mounting in a response, and we want your body to be able to recognize that flu virus and fight it off, and that can be a sign that your body is gearing up to do that. So another thing I would say is the flu vaccine cannot give you the flu. You might have some symptoms of feeling sick. Generally, those can be helped with taking ibuprofen or just treating your symptoms, but that is not the flu. If you do test positive for the flu after the vaccine, that means you were already exposed. So a lot of people feel like the flu vaccine can give you the flu virus, but that is not the case.
So are we anticipating, um, like a flu season like none other this year, or what are they saying?
Well, what we're saying and people are talking about now is the twindemic. So we have COVID and then it's flu season as well. Everybody's going inside, there'll be more people. A lot of people are gathering. So that's the big concern is having both COVID going around and the flu. So the vaccine provides you a level of protection. The flu virus mutates. So that's why you have to get a vaccine every year because it changes a little. And so they look at what's happening below the equator and saying, okay, this is what we're seeing. Let's formulate this vaccine like this for the flu season. And it takes about 2 weeks for the flu vaccine to be fully effective. And if you do get the flu after getting the vaccine, your symptoms should be a lot milder because your body should be able to recognize it on some level than if you were not vaccinated from the virus.
And then a lot of people say they feel discomfort afterwards. So that is normal to just have a little sore arm or
For
something like that.
sure. That's normal with any kind of vaccine.
All right. So let's talk about some of the other vaccines that we should consider. Let's talk about the shingles vaccine.
Shingles. So if you're over 50, the shingles vaccine is recommended for you. Um, I'd say probably about 10 years ago, there was a different shingles vaccine, but over time, as people got older, the effectiveness went down to like less than 40% as you got older. But this newer vaccine, it stays well above 90% effective well into your 90s. So it's a better vaccine. It does require 2 doses. So you'll take your first dose and then you'll come back in 2 to 6 months to get that second dose, and then you're considered fully vaccinated from shingles, which is, a lot of people, I think people are talking about it more now. The person that had shingles, usually they become the best ambassador for the vaccine because it's such a painful, it can be very debilitating if you get shingles. And then some of those symptoms can continue on: nerve pain, discomfort, scars from the sores that the shingles can cause. So I definitely recommend that people get it. And the shingles virus is the same one that causes chicken pox. So when you were little, if you had chicken pox, those sores go away, but the virus lies dormant in your body. And so depending on situation, stress, illness, things like that, it can become reactivated and cause shingles, which is the adult version. And it can be very painful and debilitating, can get in your eye. So it's just best to be vaccinated against it. And it's not just older people. Anyone can come down with shingles if they've had the chickenpox virus before. And people in their 30s, high stress situations. So, yeah.
Okay. All right. Well, let's talk about the HPV vaccine.
Yeah, that one came out, I want to say the early 2000s. It's recommended for children either 9 or 11 and up, and adults, generally up until the age 26 or so. But we're seeing it being recommended for older adults as well. The HPV virus is what can cause cervical and ovarian cancer and some mouth and throat cancers. So it protects against, I believe, 11 different strains of HPV, the vaccine does. So talk to your doctor about that one. There's varying thoughts on it, depending on your situation and your stage in life. A lot of adults have already been exposed, and our bodies can naturally fight off um, that HPV, but they're different strains. So there may be some benefit to getting the vaccine if it's covered by your insurance or if you have access to it. I definitely recommend having a conversation with your provider about that one.
So, as far as like the shingles and the HPV vaccine, are they very expensive if you don't have insurance?
They can be very expensive. Both of them are over $100, sometimes over $200. So they can be very expensive if you don't have insurance. But there are some programs out there that will help with the cost of those vaccines.
Okay. Well, let's talk about the tetanus. Now, I never thought that I needed to get a tetanus.
Yeah. So tetanus, it we call it Tdap. It covers tetanus, diphtheria, pertussis, and it's important to get that every 10 years. What we saw, I keep saying 10 years ago, but about 10 years ago, what we saw is there was a rise in pertussis. So that's whooping cough. Are you familiar with that? Some children can get it. And what was happening, the children were being babysit by their grandparents, and their grandparents, their tetanus vaccine or Tdap vaccine had worn off. And so they were passing it to their grandchildren. So it's recommended to get that booster shot every 10 years. And it's also recommended for pregnant women before they deliver so that they can pass that immunity onto their unborn child, because they can't get their first shots until after 2 months. So if the mom is vaccinated during that last part of their pregnancy, that immunity can be passed on to their children. So yeah, tetanus is, and then they'll also, if you get bit by a dog, step on a rusty nail, that's the vaccine they'll want to make sure that you're up to date on.
Okay. All right. Is it very painful?
I don't know what to say when people ask me that question because it's a shot. I don't consider them pleasant, but that one, it can sting. It has a little sting to it, but that should not be a deterrent for you getting your vaccine.
All right. So let's talk about the COVID vaccine. Why is it important?
Well, simply put, it's the best defense we have against this unprecedented, unseen before virus that has killed so many people in our communities and across the world. And I understand the hesitation early on. It is a newer vaccine using newer technology. However, at this point, the COVID vaccine is the most studied vaccine that we have to date. Over 300,000 people participated in the trials at this point. 30,000 people. And we continue to test and monitor. There's active, if you have any type of reaction or issue from the vaccine, there it can be reported and investigated. So that's kind of how we found out about the heart conditions it was causing in some young boys and other things related to it. But simply put, it is our best defense against this horrible, horrible virus, and it can protect you from hospitalization and severe disease in most people.
So for the people who have already contracted COVID, do they still need to get vaccinated?
It's a great question. So we'll call it immunity from having COVID. Generally, they're saying that lasts between 90 to 120 days. So you're considered protected during that time frame. But after that, or even before, you don't have to wait the 90 days unless you were in the hospital and received some treatments that I don't think that they were giving early on. But as soon as you're symptom free, you can go get the vaccine. And it is recommended to get the vaccine even if you've had COVID. But from having COVID, you should have some level of protection from 90 to 120 days after you had COVID.
So what do you say to that parent that is hesitant to get, they may be vaccinated, but they do not want to vaccinate their children? What would you say to that parent?
I would say talk to your providers, pharmacists, physicians, nurses, your person, not your friend down the street that may be one of those physicians. And, the children are most sacred. That's why we didn't roll out the vaccine and start giving it to children right away. Studies had to be done. Extra caution had to be taken. And at this point, that has happened. So I would recommend that you highly consider getting your children vaccinated. Again, it's the best defense we have against this virus that caused the pandemic. Most children can do okay if they do contract COVID, but we have had, I think, around 700 children that have died from COVID. So I think it's something that you should look into heavily and take into consideration, as well as continue to practice safety measures.
All right, so I do have a question here. Mm-hmm. Janet wants to know, do we need to get the booster?
I would recommend that you get the booster. Over time, if you don't have the booster, your protection from the vaccine can wane. And so that booster gets you back up to that 95%, around that 95%. So hopefully, another vaccine we didn't talk about is hepatitis A and B, and that's a 3 series vaccine. So you get one, and then in 2 months, another one, and then in 6 months, the third one. So that might be the same for the COVID vaccine, 3 doses, and then maybe we're done. But that's still to be determined. So I definitely recommend the booster. And you should get it are eligible to get it 6 months after your second dose.
So what do you say to the person that after they got their COVID shot, they got sick, meaning they had flu-like symptoms, maybe had fever, very tired. Is that normal? Is that the same, the way you were saying with the flu shot, your body is actually fighting it and building up an immunity to it?
Your body's doing what it's supposed to do, for sure. So if I were the one to give you your vaccine, I would counsel you before and say, okay, it's very normal after the vaccine to have arm soreness, feel tired, feel like you're coming down with something, fever. Some people have stomach issues. That's not the most common. And headache. Headache is another common thing. Those things may happen, or none of that may happen. Either way is normal. And if you do have after effects, then they can last between 1 and 4 days. I would say the biggest thing that most people complain about is the arm soreness and feeling tired. and headache. So those are the top 3 that I try to make sure everybody that sits in my chair leaves knowing that it's normal to experience those. So to treat those, you treat the symptoms, headache, Tylenol, ibuprofen, things like that to help.
Okay, so what other vaccines can you think of? Have we covered them all that you can think of?
Yeah, those are the main ones. I'm really an advocate for shingles, and then yeah, all the ones that we discussed are the most common ones. Now, there are vaccines you'll need to get if you're traveling, or if there's some that you missed in childhood, like measles, things like that. You can get caught up on those, but we talked about the ones that I give the most, and the ones that and so meningitis is another one, but most students that are going into college or any type of dwelling where they're living with other people, they're required to get that one. I had a friend, um, I worked with the NAACP in college at Xavier, and then the president at the Tulane chapter, she ended up passing away from meningitis, and that was before that was required for college. So that would be something for young persons that are going to be living in a dormitory style environment that I would recommend as well.
So let me ask you this. If someone is anticipating flying out of the country, are there any vaccines that you recommend? Is it just, is it like standard vaccine that you take if you're going out of the country, or is it specific to certain areas?
It's specific to certain areas. So you would need to go to, I think the CDC website will tell you what's required. And then, of course, that country, their customs website will tell you what's required. But depending on where you go, some countries will require you to be vaccinated against yellow fever, be taking malaria tablets, things like that. So it just depends on where you're headed.
Awesome. All right. So let's talk about your book. You wrote
My
a
book.
Yeah.
I did write a book. So I've been practicing pharmacy for 17 years, and there's just things I really enjoy talking to people most days. I'll keep it real. But there's some things that we find ourselves repeating over and over. So I decided to take that information and put it in a book and publish it. So it's called 20 Pharmacy Facts and Hacks You Should Know.
All right. And can you get it on Amazon, or how do you?
Yeah, you can get it on my website, drsylviaperry.com, or you can get it on Amazon. So either one. I pulled out a copy because you mentioned it. So this is it right here. And it's not a long read. It's very easy to read, but I think it has some very great information that everybody should know.
Okay. All right. And then you're a podcaster as well, right? Tell me about your podcast.
So I have a podcast that keeps me very busy here lately. It's called Three Friends Talk. So it's myself and 2 other pharmacists that I went to school with. And we're just having health conversations about health, friends, and fun. It's important for us to be healthy on every level, spiritually, mentally, physically. But in order to do that, stay healthy, you have to have fun and have community. So health, friends, and fun is what the podcast is about. We're very focused on doctors coming and taking off their white coat, because at the end of the day, we're all the same. And if we can have a conversation with somebody and you listen, and if you experience a situation, you're not intimidated because they have that white coat, you know how to advocate for yourself and make sure that you leave that office having a great understanding or great knowing what your next steps are.
Well, that is wonderful. Well, if there aren't any more questions, I want to say
one.
Let's see. Oh, do you recommend shingles shot for someone age 55?
Yes, if they didn't get it already, I definitely recommend it. I would say the same thing for someone that was 75. If they hadn't got the shingles vaccine, both doses, because for sometimes there's a shortage, and so you might not be able to get it in that 2 to 6 months window, that second dose, I still want you to go back and complete the series, even if it's a year later. So yes, anyone over 50, I definitely recommend both doses of the shingles vaccine.
And that's regardless to whether you've had the chicken pox or not, right? Or is it specific to if you've had the chicken pox?
Generally, it's blanket anyone over 50. Now, you know, there are always exceptions if you have some type of immunocompromising condition. So definitely discuss it with your physician. But generally speaking, it's anyone 50 or over. If you haven't had the chicken pox, let your doctor know. And then, we have a chickenpox vaccine now. So this generation, they didn't have to go through that. They don't have the marks on their legs. So definitely speak with your provider first.
Awesome. Well, any final words of encouragement? Anything that
I
you would
just want
like
to
to say?
say thank you for having me. I'm so glad that you have this platform and are sharing with people. You're always such an encouraging spirit, and I'm glad that more people get to see that. And hopefully, today's conversation has helped somebody along the way. You can connect with me on social media at DrSylviaPerry. And again, I mentioned my website, drsylviaperry.com, and let's continue to live healthy lives.
Okay, well, I thank you so much, and everyone. I will post her information after this broadcast so that you can connect with her. Let me make sure we don't have. Okay, great info. All right. Well, I thank you so much,
Thank
and
you.
it has been such a pleasure, and I love you.
I love you too. Happy Thanksgiving.
You too. All right, everyone. We have a great guest next. We have ImaniC Designs. Uh, I am just super proud of Imani. Hi. How are you today?
Good, and yourself?
I am doing great. Imani C is my vendor of the week. So I just started that this week. And the purpose of the vendor of the week is, Christmas time is coming up. So I wanted to actually introduce you to some of the businesses that I patronize and that I love very much. And this is definitely one of them. She has created several t-shirts for me. When my very first mask, she created that for me, and she's created a cup for me, and I am just super, super proud of Imani. So how are you doing today, ma'am?
I am doing good. Cannot complain.
Good. So how long have I known you?
Up, I want it over 10 years.
Over 10 years. So
Over
that
10
means you were
years.
12 when 11 when I
Yes.
met you.
Really, I don't even remember how old I was.
Well, it is such a pleasure to have you on the show today. So let's talk about Imani C and what made you decide to start the business.
So, ImaniC Designs is a t-shirt, customized t-shirt, customized everything business. I could do masks, I could do cups, I could do coasters, I could do almost anything you want customized, I could do it. And it started literally, what happened was I had been working my job for almost 5 years. I graduated college, moved, was still working that job. And then they were doing things that were not fair. And I got fired. And that same day, my mom bought me my first machine, and I have never gone back. And I believe that ImaniC Designs is the tool that God has given me to be able to be a blessing to other people. I remember when I was in college and I would look and I'd be like, man, one day I'm going to have enough money to give other people and not be stressed out about it. And I truly believe that ImaniC Designs has been the tool that God has given me. I've been able to give a couple of scholarships. And whenever people are in need, I don't have to hesitate anymore. Something I could just do.
Well, that is wonderful. So why don't you show us some of your products? I
I
see you got
will.
your t-shirt on, first of all.
Yeah. Yeah, they see that.
I,
Customized t-shirts and more. Um, for Christmas, glad we're here for Christmas. I have started doing mugs. Let's see if you can see that. Okay.
oh, that's
You can put your pictures
beautiful.
on there. Hold on. Let's start it here. Okay. And I
Oh,
do have pictures.
that is beautiful.
Sorry, I'm trying to learn the camera.
Okay.
Okay. Um, we have these customized glasses. See if
Oh
you can
my
see
goodness.
that.
All you people who are about to get married.
Yes.
Mm.
Magnets for your. There
Oh,
you
it's
go.
personalized. It has a picture.
Yes, customize. You put your picture, your words on your magnets, coasters.
That is beautiful.
Look at that. You see that?
I do. That is beautiful.
Okay. And of course, we have our here t-shirts. Wrong way.
Oh, now I really like that one. That is very nice.
Yes, yes.
All right, all right. So, what's the turnaround time on an order?
Turn around for things like 10 items or less would be between 7 to 10 business days. More than that, we try to get it out within 10 to 12 business days.
Okay, here's a question. How long do it take for custom t-shirts?
Custom t-shirts are the same thing. It's not after you put your order in, we'll get to designing. After your design is approved, it'll be between 7 and 10 business days.
And the one thing that I can say to everyone, you can actually just tell her what you wanted to say, and then she creates the design. And like I said, she created a bounce house shirt for me. I guess my next project is my Touching You t-shirt that I'm going to need.
Oh yeah, with a little bling on it.
With a little bling on it. We're going to put
Yeah.
some bling on it. And she created the cup. My cup actually, and I really should have brought it. It actually has like little bling on it, little shiny stuff on it. It has my name. Uh, do we have any other questions out there for Imani?
Let me go on and put it out there. You can follow me on Facebook, Instagram, and hold on, not Twitter. Uh, TikTok. That's what it is. TikTok. ImaniC Designs. It's the same thing for everything.
Okay, well, I will definitely post your information out there. And is there anything else you want to tell us? What about that person who is thinking about starting their own business? What do you say to them?
Don't think, just do it. If God gave you the vision, He gonna provide for you. Do it,
Just
and
do it.
don't worry about competition because it's gonna be competition in anything. Do your best, and God will reward it.
Right. Well, I am super proud of you. I am so happy. And, maybe I'll have my Touching You Talk Show t shirt by next week that I can display
I
for
got you.
everyone to see. And I want to thank you so much for being a guest. And I want to thank your mom. I
Oh
know she's
yes,
an inspiration to you, and she is such a blessing, and she's so sweet. And I love her so much. I love both of you so much.
I agree. Because of
So,
my mama, I can.
all right. All right. That is wonderful. Okay.
Miss Janet, I see her question. Just inbox me and we can definitely get pictures put on a t-shirt or a couple t-shirts.
Awesome. Well, all right then. So, are there any other questions? I know Lady Terry Cooper needs to reach out. She's got a book. You probably could do a customized T-shirt for her brand new book. That would be great.
But we could do a t-shirt. We could do the mugs. We could do cups, socks.
All right. Here's a question. Do you have a setup fee?
Yes, I do have a setup fee. Setup fee varies based on what it is that you need being made.
So, what is a setup fee?
So setup fee is for basically if I have to design your shirt, it'll just because it takes a couple more hours to do. It's just you set it up and you get to use whatever design it is, probably at a cheaper rate when you buy your shirts.
Okay.
So and it comes with your proofs and your confirmation and all that kind of stuff. So it's best to bring your design or you get a setup fee.
All right. Is there a deposit?
Yes, there is a deposit. It's a 50% non-refundable deposit, and you'll just pay the rest when you get your shirts or your whatever items you order.
So, only serious buyers are recommended.
Yes, ma'am.
All
We
right.
we we talk after your deposit.
Okay. Do we have any other questions? This is great. Well, Imani, I appreciate you being on tonight, and I will definitely post your information on on the on the link to this particular broadcast so that everyone can reach out to you afterwards. So thank you so much for being my guest on today. I'm super proud of you, and you just keep on letting the Lord use you the way you are.
Thank you for having me on.
All
I'm very
right.
proud of you too as well.
Thank
You're
you
doing a
so
good job.
much. Thank you so much. Well, everyone, this has been Touching You Talk Show. Thank you for joining us tonight, and I will see you next week. Have a good one, everyone.